A very good evening to all of you doctors. Today we are going to deal with anesthesia multiple choice questions. Anesthesia forms a very important part of the Neetpg entrance examination. Anesthesia forms a very important part of Neetpg entrance examination. So let us begin with the first question. All are the indications for one lung ventilation except all are the indications for one lung ventilation except A. Bronchopleural fistula. B. Massive hemorrhage in one lung. C. Video assisted thoracoscopy. And D. Cardiac surgery. All are indications for one lung ventilation. Bronchopleural fistula, massive hemorrhage in one lung, video assisted thoracoscopy, except cardiac surgery. So the correct option here is cardiac surgery. Now, what is one lung ventilation? One lung ventilation or OLV or lung isolation is frequently employed for intrathoracic surgical procedure. It is applied for intrathoracic surgical procedures and also used in situation where the pathology may affect one lung but not the other. Lung isolation, lung isolation may be accomplished by a number of methods including double lumen endotracheal tubes, placement of a bronchial blocker through a single lumen. You can use a double lumen endotracheal tube or placement of a bronchial blocker through a single lumen endotracheal tube. Or you can use a single endobronchial tube. Single endobronchial tube. So this is what are the indications for lung isolation? For proper surgical exposure, protection of contralateral lung. If the one lung is the affected one, then we want to protect the other lung. So protection of the contralateral lung from injury or pathology. Maintenance of continuous ventilation during differential lung ventilation. So it can be used in bronchopleural fistula. In history of lung transplant with severe obstructive disease of native lung, large bleb or bulla. Other indications are to prevent damage or contamination of healthy lung, control or distribution of ventilation, bronchial disruption from trauma, single lung lavage. So all are the indications for one lung ventilation except cardiac surgery. So the correct option here is cardiac surgery. Now coming to the second question. All are the benefits of supraglottic airway device over endotracheal tube? A. It is less invasive. B. It causes less hemodynamic alteration. C. It prevents aspiration. D. It requires less time for insertion. C. What happens? In fact, endotracheal tube is the best device to prevent aspiration. Whereas with laryngeal mask airway, that is supraglottic airway, LMA, very important, laryngeal mask airway, there is an increased incidence of gastric aspiration. Gastric aspiration. So this laryngeal mask airway is a supraglottic airway, which sits in the hypopharynx and partially protects the larynx from pharyngeal secretion, but it cannot protect from gastric regurgitation. Advantages of LMA are laryngeal mask airway or supraglottic airway is it is easy and rapid, it is less invasive, it has a better hemodynamic stability, It is very useful in difficult intubation. There is less tooth and laryngeal trauma, does not require muscle relaxation, does not require neck mobility. So the advantages of supraglottic airway or laryngeal mask airway is it is easy and rapid, it is less invasive, it has a better hemodynamic stability, very useful in difficult intubations, less tooth and laryngeal trauma, does not require muscle relaxation, and it does not require muscle stability, neck mobility. Now, what are the disadvantages of laryngeal mask airway? There is increased risk of gastrointestinal aspiration. It is less safe in prone or jackknife position. It is a less secure airway. There is greater risk of gas leak and pollution. This can cause gastric distension. The disadvantage is that there is an increased risk of gastrointestinal aspiration, less safe in prone or jackknife positions. It is a less secure airway. Greater risk of gas leak and pollution can cause gastric distension. So, from the given options, except one is that it prevents aspiration. In fact, it is more responsible for gastrointestinal aspiration. So the correct option here is C. It prevents aspiration. I hope it is completely clear this question is. Let us move forward. The most frequently reported malfunctions in a medical gas pipeline system is most frequently reported malfunction. Most frequently reported. Now, what are the different problems with the medical gas pipeline system? There is inadequate pressure. It is the most commonly reported problem. Damage during construction projects. Fire can occur. Theft of N2O tanks. N2O tanks, there can be theft. Environmental, earthquake, lightning can damage. Depletion of central supply. Human error. Sometimes there can be accidental closure of shut-off wall, which can be dangerous. Obstruction, debris following installation. Then pipes can kink. There can be a leak. Same thing, whatever happens in a pipe. Kinking, leak, obstruction of a hose, contamination, accidental shutdown, obstruction due to debris. Obstruction due to debris. So the most frequently reported malfunction in medical gas pipeline system is what are the most common? Inadequate pressure. As I have already told, it is inadequate pressure. So the correct option here is A. Color of shoulder of oxygen cylinder shoulder is A. White, B. Black, C. Blue, D. Yellow. Color of shoulder of oxygen cylinder is it is oxygen shoulder is cylinder shoulder is white, whereas the body is black. So the correct option here is B. Black. Shoulder is white. Shoulder is white. Body is black. Body is black. Shoulder is white. So correct option here is A. White. Massive transfusion of stored blood results in. Now this stored blood contains citrate, phosphate, dextrose. So this can cause citric acid toxicity. So the correct option here is A. Citric acid toxicity. The gene for ryanodine receptor mutation, which is responsible for malignant hypothermia, is located on which chromosome? A gene for ryanodine receptor mutation which responsible for malignant hyperthermia. Malignant hyperthermia is a genetic condition, autosomal dominant condition. It is a hypermetabolic muscle disease. So the gene is present on chromosome number 19. So the correct option here is chromosome number 19. First sign of accidental intraarterial injection of drug is first sign of intraarterial injection of drug is it is pallor. Pallor. First symptom of accidental first sign is pallor and first symptom is pain. So if had they asked the question as symptom, then it is pain, and the sign is pallor. Sign is pallor. Whenever you inadvertently inject into the artery, intraarterial injection is suspected. The first instruction is to remove the indwelling catheter. However, from a practical standpoint, this is not the best approach. This is not the best approach. So the correct option here is B, pallor. Highest concentration of oxygen is delivered through. Again, it is a very important question, repeatedly asked. Highest concentration of oxygen is delivered. Now, bag and mask ventilation delivers 100% oxygen. Venturi mask delivers 60% oxygen. Mask with reservoir 80 to 90%. Nasal cannula only 40%. Nasal cannula 40%. Venturi mask is 60%. Bag and mask is 100%. So the correct option here is bag and mask 100%. A 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check pulse. B. Chest compression. C. Call for help. D. Scene safety. The first thing that needs to be done on witnessing a cardiac arrest is to verify the scene safety. On ensuring the scene is safety, the victim is checked for responsiveness. If unresponsive, call for help and then check for breathing and pulse simultaneously, taking not more than 10 seconds. If there is no breathing and no pulse, immediately chest compression and rescue breaths are started at a ratio of 30:2. If there is a pulse but no breathing, give one rescue breath. Give one rescue breath. So the correct option here is scene safety. A patient with stable atrial fibrillation, what treatment should be started? A patient with stable atrial fibrillation, what treatment should be started? A. IV abutolide. B. Immediate cardioversion. C. Amiodarone. Amiodarone. Patient is in atrial fibrillation, but the hemodynamic status is normal. So treatment of choice is IV abutolide. Now what is ibutolide? Ibutolide is a class 3 antiarrhythmic drug which has a rapid onset of effect in restoring the sinus rhythm. It acts by prolonging the action potential duration and effective refractory period. So APD and ERP are prolonged. It is administered in a dose of 1 milligram over 10 minutes. If necessary, a second dose can be administered 10 minutes after the first. If there is evidence of hemodynamic deterioration, immediate cardioversion is the treatment of choice. If there is hemodynamic deterioration, then you do immediate cardioversion. Now, how much shock will you deliver? If a monophasic defibrillator is used, 100 joule to 200 joule. And if a biphasic defibrillator is used, then it is 100 to 120 joule. So the patient is in atrial fibrillation, but the hemodynamic status is normal. Give IV ibutolide. Ibutylate is a class 3 antiarrhythmic drug. It has a rapid onset of action to restore sinus rhythm. It acts by prolonging the action potential duration and effective refractory period. How much you administer? Dose of 1 milligram over 10 minutes. You can repeat the dose 10 minutes after the first dose. If there is hemodynamic deterioration, then immediately do cardioversion. So the correct option here is IV ibutylate. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to puberty? This is a very important question, tricky one, but very fundamental conceptual one. Pulse check in a child who is anywhere from 1 year to puberty. Now, when do you use brachial artery? Brachial artery is located on upper arm and is used in infants below 1 year old. The ulnar artery is not used to perform pulse check. Ulnar artery is not used. The temporal artery is not used to perform pulse check. So they don't use temporal artery, they don't use ulnar artery. Carotid and femoral artery are used to perform pulse check from 1 year to puberty. So carotid and femoral artery. So the correct option here is B, carotid or femoral artery. Depth of anesthesia can be best assessed by depth of anesthesia can be best assessed by A, pulse oximeter, B, end-tidal PCO, C, ABG analysis, D, bispectral index. Now, what are the monitors that are used to assess the depth of anesthesia? You can use the EEG, electroencephalography, bispectral index, BIS, entropy, evoked response, that is brainstem evoked potential, patient safety index. So the correct option here is bispectral index. Most commonly used nerve for neuromuscular monitoring under anesthesia. Neuromuscular monitoring. Which nerve you use? Ulnar nerve most common. Ulnar nerve is most common used. Correct option is B, ulnar nerve. Best site for core temperature monitoring during malignant hyperthermia. We all know it is esophagus. Now, why esophagus? It is esophagus. Correct option here is B, esophagus. What is contraindication for ECT? Contraindications for ECT. Contraindications for ECT are absolute contraindication is increased intracranial tension or cerebrovascular response to ECT, including absolute increased intracranial tension, cerebrovascular response to ECT, including marked increase in cerebral blood flow and blood flow velocity. Cerebral oxygen consumption increases as well. The rapid increase in systemic blood pressure may transiently overwhelm cerebral autoregulation and may result in increased intracranial pressure. The use of ECT is prohibited in patients with no space occupying lesions, that is, brain tumor or head injury, cerebral aneurysm, intracranial aneurysm. Relative contraindication are recent myocardial infarction, severe hypertension, severe pulmonary disease, pheochromocytoma. So the correct option here is D, cerebral aneurysm. The following are methods of invasive cardiac monitoring. Invasive cardiac monitoring. Transthoracic echocardiography is minimally invasive form of cardiovascular monitoring. So the correct option here is transthoracic echocardiography. It is minimally invasive. Others are invasive. Ashner reflex is seen in. What is Ashner reflex? Can anybody please comment in the chat box? Ashner reflex. Ashner reflex is also called oculocardiac reflex. It is also known as Ashner phenomenon, Ashner reflex, or Ashner-Dageny reflex. It is a decrease in pulse rate associated with traction applied to extraocular muscle. There is a decrease in pulse rate, that is known as oculocardiac pressure, when there is a traction applied to the extraocular muscle or compression of eyeball. The reflex is mediated by nerve connections between ophthalmic branch of trigeminal cranial nerve via the ciliary ganglia and the vagus nerve of parasympathetic nervous system. So the correct option here is D, squint surgery. All are indications of evoked potential monitoring. All are indications of evoked potential monitoring. Cerebral tumor resection, brachial plexus repair, mastoid surgery, spinal fusion, and instrumentation. Indications of intraoperative monitoring of evoked potential include surgical procedures with possible neurological insult. These can include spinal fusion and instrumentation, brachial plexus repair, thoracoabdominal aortic aneurysm repair. So the correct option here is mastoid surgery. Mastoid surgery. All others are the indications of evoked potential monitoring. A heavy smoker when posted for elective surgery. When should he stop smoking? Posted for elective surgery. When should he stop? 6 to 8 weeks before surgery. The options are 3 to 4 days before surgery, 1 to 2 weeks before surgery, 2 to 4 weeks before surgery, 6 to 8 weeks before surgery. So the correct. Now, what happens when a person stops smoking? Within 12 to 24 hours, there is fall in carbon monoxide and nicotine levels. 48 to 72 hours, carboxyhemoglobin normalizes. 1 to 2 weeks, decreased sputum production. 4 to 6 weeks, PFT improves. 6 to 8 weeks, normalization of increased immune function, immune function, and decreased post-operative pulmonary complication. 6-month risk is similar to that of non-smokers. So the best thing is 6 to 8 weeks before surgery, because there is a decrease of post-operative pulmonary complications. So the correct option here is 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary artery is denoted by. So when you do the pulmonary artery catheterization, what happens? The entry into pulmonary artery is denoted by there is a increase in diastolic pressure. So the correct option here is C, increase in diastolic pressure. Most common complication of pulmonary artery catheterization is. This pulmonary artery catheterization is a very important topic. They ask repeatedly. Most common complication of pulmonary artery catheterization is arrhythmias. Arrhythmias is the most common complication. So the correct option here is arrhythmia. Now, what are the complications of pulmonary artery catheterization? Arrhythmias ventricular fibrillation, right bundle branch block, complete heart block. Then catheter related, mechanical catheter knots, thromboembolism, pulmonary infection, endocarditis. Which among the following is the best monitor to detect abnormal hemoglobin? It is carbon monoxide, CO oximeter, CO oximeter. It is CO oximeter. Now, what is CO oximeter? CO oximeter is the best monitor to detect abnormal hemoglobins. CO oximeter utilizes an 8 wavelength sensor, 8 wavelength sensor to distinguish between oxygenated blood, deoxygenated blood, and blood containing carbon monoxide. CO oximeter is useful in monitoring carboxyhemoglobin and methemoglobin. CO oximeter. So the correct option here is CO oximeter. Plasma cholinesterase is reduced in all of the following conditions. Plasma cholinesterase is reduced in all of the following conditions: pregnancy, liver disease, malnutrition, hemolysis. So let us see what are the conditions there is reduced butyryl cholinesterase activity. Reduced butyryl cholinesterase activity is seen in liver disease, pregnancy, malnutrition, old age. When the patient uses drugs like oral contraceptive, monoamine oxidase inhibitors, MAO inhibitors, ecothiopate, cytotoxic drugs. Cytotoxic drugs. So the correct option here is B, hemolysis. Which of the following is not a complication of succinylcholine? Not a complication. Succinylcholine is very important. You must know everything about succinylcholine. A, increased IOP. B, increased ICP. C, increased BP, decreased heart rate. Now let us see what happens. Side effects of succinylcholine are cardiovascular, sinus bradycardia, junctional rhythm, ventricular dysrhythmia, hyperkalemia, myalgia, masseter spasm, malignant hyperthermia, increased intracranial pressure. So the correct option here is increased IOP. Increased IOP is not a complication of succinylcholine. Water content of soda lime is water content of soda lime is it is a direct question. Water content of soda lime is 15%. So the correct option here is D, 15%. I hope you have understood all the things till now. Let's meet tomorrow. Uh, I wish you all of you a very good preparation, and finally the result will also be good. The only thing is that practice at least 100 MCQs daily. This will help you in your real examination. The more number of mock tests you give, the more practice you make from wherever source you want. It will help you to reach your goal fast forward. Wish you all the best. God bless you. Good night.